Today, we're diving into the fascinating world of epidemiology. It's a field that's critical in understanding how diseases spread, why some populations are more affected than others, and how we can prevent illness on a larger scale.
Absolutely. Epidemiology essentially looks at the distribution and determinants of health-related states and populations. So, it's more than just tracking diseases. It's about understanding factors like lifestyle, environment, genetics, and even social conditions that influence health outcomes.
Right. And one thing that always strikes me is how epidemiologists track the spread of diseases. It's not just about numbers and stats, it's about identifying patterns. How does that work, though?
Well, they use a combination of data collection methods, surveys, case studies, and even looking at historical data. For instance, they might look at how a disease spread across different regions and time periods to find out what factors were at play. It's kind of like detective work, but with health.
Interesting. So when we talk about determinants of health, we're not just talking about biological factors, right? It includes things like socioeconomic status, access to healthcare, or even air quality.
Exactly. It's this whole web of interconnected factors. For example, people living in poorer areas may have higher exposure to pollution or limited access to healthy food, which can increase the risk of certain diseases. Epidemiology helps us understand these connections so we can target interventions.
And that's key in shaping public health policies. If you know what influences health in a specific group, you can create more effective programs like vaccination campaigns or health education tailored to those populations.
Yes, and that's why epidemiology has been so crucial during pandemics like COVID-19. It helped officials understand the disease's transmission, which was essential for controlling the spread. They can trace outbreaks, identify high-risk areas, and even predict where the next spike might happen.
It's crazy how much we rely on that data to make decisions in real time. Speaking of which, do you think there are areas of health that still don't get enough attention from an epidemiological standpoint?
I think mental health is one area that's still understudied. There's been a shift, but historically, mental health has been less prioritized compared to physical diseases. But now we're starting to see more epidemiological studies focusing on mental health trends, which is really encouraging.
Yeah, it's about time that mental health gets the same level of attention. If we can better understand how societal factors contribute to mental well-being, it could lead to more effective strategies for prevention and treatment.
Exactly. So in the end, epidemiology is all about connecting the dots between different factors to improve health at the population level. It's about understanding not just who gets sick, but why, and how we can change that.
Absolutely. It's a powerful tool for improving health on a global scale. Well, that's a wrap for today. Hopefully this episode has given you a clearer picture of how epidemiology works and its impact on our everyday lives. Thanks for listening.
Thank you. And remember, health is more than just individual choices. It's shaped by many different factors, so let's stay curious about how we can improve it for everyone. Catch you next time.